Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States. I can tell you where I am right now. I am in the United States right now. I work as a Chief Medical Officer, also Associate Professor of Medicine, one of the large medical schools. Now, we've been doing a lot of videos on educating the public about, before you go to the labs, what kind of things you should be checking for, you should be watching out for, okay? Today our topic, let's say your doctor ordered potassium level. We call it big K. So what are the things you should be doing? Usually what happens is like the patients don't understand the process. They go to the lab and they get an abnormal value and they get all paranoid and they said like, oh, what should I do? What should I do? And then most of them, what happened, they wanted to go back and repeat it to make sure that's normal or not. So don't, we're trying to prevent that kind of situation. So we're going to tell you before checking potassium for the lab results, what do you have to do? First thing, always, you make sure before you go to the lab, the prescription is ready, make sure it's the right prescription, go there with the loose clothing so when they draw blood and all that. Okay, now, the first question, you go there, what do you have to do before you check in the potassium? The first question is like, is fasting needed to be done for checking potassium? There's no need to be fasting, okay? But if you fast, it doesn't make a huge impact on the lab results. Do I need to drink a lot of water? Not really, it doesn't affect. So usually the normal drinking water is okay. Can I do intense exercise before the test? Please. I've seen this all the time. Some people usually get up in the 5 o'clock in the morning and start exercise for like, military grade exercise, like 1 to 2 hours, and then go to the lab. You can have a muscle breakdown, don't do that. Don't do any kind of extreme exercise. Regular thing, whatever you're doing, you continue to follow. And so I would not recommend anyone to do exercise before you check in the potassium, okay? The next thing, I'm having severe vomiting, diarrhea, doctor, should I go and take the test? No, because you're going to lose potassium in the stool and the vomit, and that's going to affect, okay? So don't do that. Can I drink alcohol before the test? No, really, so don't do it. Just 24 hours I would take caffeine, smoking, alcohol, no, okay? What are the other food I need to avoid before the testing? Now, there are a lot of fruits out there which have like a lot of potassium in it, right? I think everybody know, like avoid banana, coconut water, avocados, caffeine, at least for 24 hours, okay? Now, can any medications impact potassium level? It's a touchy one. A lot of people are on medication now these days. Yes, it does have some effect. So what are they? Diuretic, we call the water pills, ACE inhibitors, ARBs, angiotensin receptor blockers, beta blockers, potassium supplement. If your doctor puts you on potassium supplement, it can affect. But don't stop any of this, but you need to know this can increase the potassium. So check with your doctor and kind of let them know. Maybe that's what the reason the potassium is going up or down, okay? So it's very important, don't stop any of this medication without checking with the doctor. So all of this labs values, just make sure you do follow our advice before you go to the laboratory. It can save you a lot of time, effort, a lot of headache also, okay? So if you like our channel, please subscribe, share. Every support you give us is very, very important. Without your support, we cannot do this. God bless. Thank you.